it's me.
Not. What is gout? Gout is the inflammation of joints or body tissues due to accumulation of uric acid crystals. Uric acid is a waste product created by the metabolic breakdown of DNA and RNA. Xanthine oxidase is the enzyme responsible for the formation of uric acids. Uric acid accumulates in the body when there's an increase in metabolism of nucleic acids or when the kidneys cannot adequately excrete all the uric acids formed. In addition to DNA and RNA, foods, beverages, and drugs may also cause an increase in uric acids.
Acute gouty arthritis occurs when sharp uric acid crystals accumulate in the joints. Chronic gout occurs within 1 to 2 years of acute gout attacks. Excess uric acid accumulates in the blood creates a condition called hyperuricemia. First gout attack commonly occurs in the big toes. It also affects the joints of the ankle, heel, knee, elbow, wrist, and finger. The symptoms of gout are severe pain, redness, and swelling in the joints.
There are two types of gout, primary and secondary gout. Primary gout is a hereditary defect in uric acid metabolism which causes uric acid to be produced faster than it can be excreted by the kidneys. Secondary gout is caused by diseases or drugs, which may increase the metabolic turnover of nucleic acids and interfere with the uric acid excretion. Drugs causing gout include thiazide diuretics, aspirin, cyclosporin, and alcohol. Conditions and diseases that cause secondary gout are diabetic ketoacidosis and kidney failure, and diseases such as leukemia and hemolytic anemia causes cell turnover rates to increase.
In this scene, Jolin represents a healthy joint, free of histamines and other inflammation-causing factors. However, for individuals with acute gout, histamine, represented by the balloons, are released and cause inflammation. As a result, the individuals experience pain. Two examples of NSAIDs used to treat acute gout are naproxen and indomethacin. Both of these drugs work by prohibiting the synthesis of prostaglandin. As a result, reduces the release of histamines and decreases the pain. Concurrent use of these drugs with aspirin may decrease its effectiveness. In addition, adverse GI side effects and the risk of bleeding may also occur.
There are 3 strategies used to prevent hyperuricemia. The first strategy is inhibiting the formation of uric acid. A prototype drug called allopurinol is used to control hyperuricemia and reduce the risk of acute gout attacks. The action of allopurinol is to inhibit the production of uric acid by blocking enzyme xanthine oxidase that is responsible for forming uric acid. In this scenario, Daniel is enzyme xanthine oxidase and Connie is the drug allopurinol. This enzyme is producing uric acid, which is represented by the balloons on the joint, and the drug allopurinol is blocking the action of enzyme xanthine oxidase. The side effects of this drug include drowsiness, diarrhea, nausea, vomiting, and skin rash. Taking this drug with ampicillin or amoxicillin may increase the risk of skin rash. Concurrent use of this drug with warfarin may increase the effects of these drugs. Large doses of allopurinol may increase the risk of theophylline toxicity and cyclosporine levels. A new drug used in this strategy is febuxostat. Its properties are similar to allopurinol. However, this drug is safer for patients with renal impairment because it is extensively metabolized by the liver.
One strategy to prevent hyperuricemia is to use uricosurics such as probenecid and sulfenpurazone. Side effects of probenecid include nausea, vomiting, headache, diarrhea, and aplastic anemia. If used concurrently, probenecid will increase blood levels of allopurinol, benzodiazepines, nonsteroidal anti-inflammatory drugs, and other drugs listed here. Large doses of salicylates may decrease its effects of uricosuric activity. Sulfenpurazone side effects include nausea, heartburn, dizziness, and ringing in the ears. Concurrent use with heparins will decrease the body's ability to make clots. Sulfenpurazone will also increase the effects of warfarin, and salicylates will decrease its effectiveness. As demonstrated here, These drugs increase the excretion of uric acid by blocking its reabsorption in the kidney.
Two drugs used in the third strategy for treatment of chronic gout are rasburicase and pegloticase. These drugs convert uric acid into less toxic forms, preventing hyperuricemia. This treatment is normally used for patients undergoing chemotherapy.
When a cancer patient is going through chemotherapy, the formation of uric acid crystals increases on the patient's joints, resulting in chronic gout. Rasburicase is an enzyme produced through recombinant DNA technology that is used to reduce uric acid levels in patients who are receiving cancer chemotherapy. It promotes the conversion of uric acid to allantoin, an inactive water-soluble compound. Some of the side effects include headaches, nausea, fever, hemolysis, or anaphylaxis. Rasburicase currently has no known drug interactions. Before administering therapy, monitor patients for anaphylaxis, hemolysis, and methemoglobinemia. Discontinued therapy if these signs and symptoms occur in the patient. Pegloticase is a synthetic enzyme that metabolizes uric acid into an inert substance. It is used to lower uric acid levels in patients with chronic gout who have not responded to conventional therapies. Side effects may include nausea, gout flare, anaphylaxis, and/or infused reactions. Pegloticase has a drug-drug interaction that may interfere with the action of other PEG-containing therapies. Prior to therapy, pre-medicate the patient with antihistamines and corticosteroids to minimize the risk of anaphylaxis and infused reaction. Daniel is representing a chemo patient's joint. The balloons surrounding him are uric acid crystals. Rasburicase will now act to reduce the uric acid crystals on the patient's joint. Pegloticase will work to transform the uric acid crystals into an inert substance.
Prior to drug administration, obtain a complete health history, drug history, and history of current symptoms and effect on activities of daily living. Obtain a dietary history and note correlations between food intake and increase in symptoms. Assess fluid intake, obtain weight and vital signs, and evaluate appropriate laboratory findings. Throughout drug administration, assess for desired therapeutic effects. Continue monitoring of vital signs and urine output. Continue to monitor uric acid level, complete blood cell count, and hepatic and renal studies.
When administering the medication, the nurse should use this time to teach patient the reason for the drug, appropriate dose and time, adverse effects to observe for, and when to report these effects. Instruct the patient to take medication at first sign of gout attack. Anti-gout drugs should be taken with or after meals.
Review dietary history and note any correlation between diet and symptoms. Increase fluid intake to 2 to 4 liters per day.
To minimize adverse effects, monitor serum and urinary uric acid levels. Monitor daily weight and urinary output and observe for skin rashes, fevers, or flu-like symptoms.
Just kidding, one more time. What is gout?